Did you know there's a virus out there with a mortality rate as high as 75%? It's one of the deadliest pathogens known to science, yet most people have never even heard of it. Today, we're diving deep into the world of the Nipah virus. So, what exactly is Nipah? It's a zoonotic virus, which means it can be transmitted from animals to humans. Specifically, its natural hosts are fruit bats of the Pteropus genus, often called flying foxes. These bats carry the virus without getting sick themselves, making them the perfect reservoir. The story of Nipah begins in 1998 in a village called Sungai Nipah in Malaysia. That's where the virus gets its name. Pig farmers started coming down with a mysterious illness. The symptoms were terrifying: high fever, severe headaches, and encephalitis, which is a dangerous inflammation of the brain. The illness progressed rapidly, leading to confusion, seizures, coma, and in many cases, death. Initially, health officials thought it was Japanese encephalitis, another virus common in the region. But the usual control measures weren't working. The outbreak spread, and the death toll climbed. It was a race against time for scientists to identify the real culprit. Through painstaking investigation, they isolated a new paramyxovirus, which they named Nipah. The investigation revealed a chain of transmission. Fruit bats, which roosted in trees near pig farms, would drop partially eaten fruit contaminated with their saliva or urine into the pigsties. The pigs would eat the contaminated fruit, get infected, and then pass the virus on to the farmers who were in close contact with them. The pigs acted as an amplifying host, meaning the virus replicated to high levels in their bodies, making transmission to humans much more likely. To stop the outbreak, a massive and heartbreaking decision was made. Over 1 million pigs were culled in Malaysia. It was a drastic measure, but it worked. The chain of transmission was broken, and the outbreak was contained. In total, the Malaysian outbreak saw 265 human cases and 105 deaths, a tragic start for a newly discovered virus. But the story doesn't end there. Nipah soon reappeared, this time in Bangladesh and neighboring parts of India, starting in 2001. And here, the virus behaved differently. There were no pigs involved. So how was it spreading? Researchers discovered a new pathway. In this region, a local delicacy is fresh: raw date palm sap, collected overnight in clay pots tied to trees. Guess who else loves date palm sap? That's right, the fruit bats. They would visit the pots at night to drink the sap, contaminating it with their virus-laden saliva and excrement. People who drank the raw, unboiled sap the next morning would get infected. This new mode of transmission presented a huge public health challenge. It's one thing to control a pig farm outbreak. It's another to change a deeply ingrained cultural practice. Public health campaigns were launched to educate people about the dangers of drinking raw sap and to encourage them to boil it before consumption, which kills the virus. But there was another, even more alarming discovery in Bangladesh. The virus was spreading directly from person to person. Family members and healthcare workers caring for sick patients were getting infected through close contact with respiratory secretions or other bodily fluids. This was a game changer. A virus that can jump from animals to humans is worrying. But one that can then spread efficiently between humans is the stuff of pandemic nightmares. The symptoms in these later outbreaks were also more varied. While encephalitis remained a key feature, many patients also developed severe respiratory distress, similar to pneumonia. And the mortality rate was consistently high, often exceeding 70%. One of the scariest things about Nipah is its long incubation period, which can range from a few days to over a month. This means someone can be infected and travel widely without even knowing they are sick, potentially spreading the virus. There's also evidence of relapse, where patients who seem to have recovered can suddenly develop neurological symptoms months or even years later. So, where are we now? Nipah is considered a priority pathogen by the World Health Organization. This means it is on a short list of diseases that pose a significant public health risk because of their epidemic potential and the lack of effective treatments or vaccines. Currently, there is no specific cure for Nipah. Treatment is supportive care, managing the symptoms like fever and seizures, and providing respiratory support if needed. This is why prevention is absolutely key. Scientists and researchers are working tirelessly on this. One of the main goals is to develop a vaccine. There are several promising candidates in the pipeline, both for humans and for pigs, which could help break the transmission cycle in agricultural settings. But vaccine development is a long, complex, and expensive process. Another crucial area is surveillance. We need better ways to monitor bat populations and detect the virus early before it spills over into humans. This involves a One Health approach, recognizing that the health of humans, animals, and the environment are all interconnected. We need veterinarians, ecologists, and public health officials all working together. Simple public health measures also make a huge difference. In areas where Nipah is known to exist, this means avoiding contact with sick pigs or bats, not drinking raw date palm sap, and practicing good hygiene, like frequent hand washing. For healthcare workers, it means using strict infection control protocols, including personal protective equipment like masks, gloves, and gowns, when caring for suspected or confirmed Nipah patients. The threat of Nipah is a stark reminder of how vulnerable we are to emerging infectious diseases. As human populations expand and encroach on natural habitats, the chances of encountering new viruses increase. Climate change can also alter the behavior and range of animals, like fruit bats, bringing them into closer contact with people. While the outbreaks so far have been relatively small and geographically contained, the potential for a larger, more widespread epidemic is very real. With its high mortality rate and the potential for human-to-human transmission, Nipah is a virus we must take very seriously. It's not about fear-mongering, it's about being prepared and proactive. The story of Nipah is a testament to the brilliance and dedication of scientists and public health workers who work on the front lines to protect us. By understanding these threats, supporting research, and promoting responsible public health policies, we can all play a part in preventing the next pandemic. If you found this video informative, please give it a thumbs up and subscribe to our channel for more deep dives into the world of science and health. And hit that notification bell so you don't miss our next video. Thanks for watching.